The skill to correctly puncture different joints in the horse is important for all equine practitioners. The most frequent use of joint injections is to diagnose and treat arthritis in performance horses. However, the ability to perform arthrocentesis is also needed when dealing, for example, with joint infections in foals and in connection with traumatic injuries involving joints. It is possible to access all major joints in both the fore and the hind legs with the horse awake and in the standing position. Some joints are very easy to puncture, for example the carpal joints, while others require more training. When infected joints are flushed or when joint wounds are treated, tranquilizers or general anesthesia can be used as needed. When working with lameness evaluation, however, it is not advisable to tranquilize the patient because sedation may affect movement patterns. If needed, a nose twitch is used to keep the horse still during arthrocentesis. When working with joint injections for anesthesia or intra-articular treatment, and especially when checking for joint perforations in trauma cases, thorough knowledge concerning the local anatomy is essential. However, if the point of insertion is carefully located in relation to the relevant anatomical structures and the needle aimed in the correct direction, most joints are easy to find, even for the inexperienced practitioner. Arthrocentesis must always be performed under aseptic conditions. If aseptic techniques are carefully observed, the risk of causing a joint infection is very low, and joint injections can be carried out safely under field conditions. To start with, the exact point where the injection is to be administered is located. The hair is clipped on an area large enough to allow for some movement of the skin should the horse change position after clipping. The skin is washed several times carefully with a skin disinfectant to obtain a sterile surface. Repeat rubbing with new swabs of cotton soaked in disinfectant until they remain white. If the injection is to be performed with the leg in the flex position, the assistant who holds the leg must be careful never to touch the clipped sterile area. If the injection is to be administered with the horse putting weight on the leg, the assistant lifts one of the forelegs to prevent the horse from lifting the leg that is to be injected. The veterinarian positions all non-sterile materials such as bottles of local anesthetics within easy reach. Non-sterile outer packaging is also open to allow the vet to access the sterile content after putting on sterile gloves. The veterinarian opens the envelope containing sterile gloves and unfolds it, taking care not to touch the inside of the envelope. This area is now sterile and can be used to place all sterile equipment, for example needles and syringes. The vet puts on the sterile gloves. If any sterile item or surface comes in contact with a non-sterile object or surface at any time during the procedures, it should immediately be changed or re-disinfected. A suitable needle size for joint injections is 21 gauge by 1.5 inches. For stifle puncture, the length should be 2 inches. When the needle has been inserted in the joint, synovial sampling and joint injections can be performed through the same needle. After arthrocentesis, the skin at the injection point should be washed once again with disinfectant and covered with spray plaster or bandage.